Hello, I'm Amber and I'm going to be your nurse today, and we're going to be doing an abdominal assessment on you. If you have any discomfort, I can stop at any time, okay? Alright, first off, I just want to start out with a little history. Have you ever had abdominal surgery?
No.
Okay, in your family, is there any history of stomach illness?
No.
Okay, what does your diet consist of?
I eat 3 balanced meals a day.
Alright, and what about your bowel movements?
I use restroom once a day.
Okay, is there any discomfort or difficulty?
No.
Alright, if you could just lay down, we're going to start out by just looking at your abdomen. And let me cover you up first. Okay, I'm just going to drape this over you. Alrighty. And we're just looking for any bulges. Okay, the abdomen is symmetrically correct. It's flat. There's no distension noted. There's no pulsations noted. Also, the color is appropriate for race. The umbilicus is center lined. There's no redness noted at all, no inflammation, and it's inverted and clean. Okay, we're going to start out. Can I look at your eyes, please? And we're checking for jaundice. And the sclera is white, no jaundice present. Can you open it? Okay, the mouth is pink and moist. There's no paleness noted. Alright, I'm just going to start out and I'm just going to listen to your stomach, okay? And we're listening for bowel sounds. Okay, bowel sounds are present times 4, and normally I would listen for a full minute. Okay, and now I'm just going to listen to the liver and spleen to check for friction rubs. Okay, and there's no friction rubs over the liver or the spleen noted. Okay, and now I'm going to be checking the arteries in the stomach, and we're going to start with the aorta, and we're listening for bruits. Okay, there's no bruit noted. Now we're checking the renal. No bruits noted bilaterally. And the iliac, there's no bruits noted. And now we're going to check the femoral. You might not be able to see me do this because I'm trying to keep them covered. In the femoral, there is no bruits noted. Alright. Now I'm just going to do I'm going to palpate your stomach, and I just need you to let me know if there's any tenderness or any pain felt, okay? Any tenderness? Alrighty. No tenderness anywhere. Okay, and I'm just going to go a little deeper this time and just let me know if it causes any discomfort. Okay, there's no tenderness noted on the abdomen, and while I'm here, I'm going to look at the umbilicus, and I'm just going to check around the edges for any hernia or disfigurement, and it's within normal limits. Alright, now I'm going to percuss the stomach, and we're just going to be listening to see what we hear, and we should hear tympani. And sometimes if the bladder's full, you'll hear dullness. but here we hear tympani. Okay. And now we're going to be checking for the liver span. And what I'm going to do is I'm going to percuss all the way up until I hear dullness, and then I'm going to make a line if that's okay. I'm going to mark, and then I'm going to go from top to bottom and mark again just to check, okay? Alrighty. Okay, I'm going to start at the top and work my way down. Okay. Now I'm going to take my ruler, or measuring tape is what I used. And it should be between 5 and 10 centimeters. And his is about 6.5. Alrighty. Now we're going to percuss the spleen. You can just turn on your side for me a little bit. Okay. And you should hear dullness when you get to it. Okay. And the spleen sounds normal. Okay, you can just lay on your back. Alrighty, and now we're going to check for rebound pain. And what I'm going to be doing is I'm going to kind of press deep and let out fast. And you just let me know at any time if you have any discomfort, okay? Any discomfort? Okay. Alright, and now we're going to be palpating the liver and the spleen. First thing I'm going to do is place my left hand under your rib cage. And I just want you to relax your body into my hand. Then I'm going to use this hand to kind of displace your liver, but I'm going to have you inhale and exhale, okay? Alright, inhale, exhale. Okay, the liver is not palpable. Inhale, exhale. Okay. Now we're going to check the spleen. I'm going to take my right hand, and you can kind of, there you go, rest, okay. And then I'm going to take my right hand, and I'm going to use that to kind of push in to see if we can feel the spleen, okay. Breathe in and exhale. Okay, and the spleen is not palpable either. So that concludes our assessment, and thank you so much.